Okay, good morning, everyone. Thank you so much for joining us. We appreciate you being here this morning. Just a reminder that this is being recorded, so we can go back and refer to it at a later time. And my name is Dorothy Dorton. I am with AARP Alabama. And like I said, I want to thank you all for joining us and welcome you. We are going to have a really good informative session today from Mr. James Roberson. Good morning, James. Thanks for joining us today.
Good morning, Dorothy. Thanks for having me. Good morning, everyone.
Well, we are very happy to have you, James. And James has worked with us on several other occasions talking about Medicare and the wonderful program called SHIP that's available. And so he is going to tell us about that today. You know, open enrollment for Medicare starts tomorrow, and there's always a lot of questions around it, a lot of confusion on choices and things like that. And so the SHIP program is just a great way to kind of help you figure all of that out and guide you through that. So we are going to get started here. And a few housekeeping, just to let you know a little bit about AARP Alabama too. We empower people to choose how they live as they age. So we are a nonpartisan 501c4, and we have over 420,000 members in Alabama. And we are here to advocate for those who are 50 plus and their families, regardless of politics. So we like to advocate, we like to educate, we like to get out in the community and do what we can to help out. So that's AARP in a nutshell. Again, just want to remind everybody, please note that this presentation is being recorded. So if you are joining us, you're aware of that and you're okay with that. We are going to put this recording on our YouTube page after the session. So you can go back to AARP Alabama's YouTube page and view this at any time. And we're also going to have James back on our AARP Alabama Facebook page live next Wednesday at 10 a.m. So we'll talk a little bit about that at the end of this session. But I am obviously not the expert on this, so I am going to hand it over to James Roberson. And James is with the South Alabama Regional Planning Commission down here in Mobile, Area Agency on Aging. And James, is your title SHIP coordinator? Is that correct?
Yes, it is. That's correct.
They should call you Captain James. So
let me have to incorporate that.
Yes, please. Pardon my pun. But James, I'm going to let you take it away because you're the expert.
Sounds good. Thank you so much for having me again. It's a pleasure to speak with all of you this morning as it relates to some of the things we do here at the South Alabama Regional Planning Commission's Area Agency on Aging. Again, I'm James Roberson. I do coordinate the Alabama State Health Insurance Assistance Program, also known as SHIP. I also coordinate Senior RX. It's a prescription assistance program that I'll speak briefly about a little later, as well as Senior Medicare Patrol. Primarily today, I want to talk a little bit, though, about SHIP and Medicare Open Enrollment as I kind of begin. Dorothy, if you don't mind going to the, well, I'll ask the question first. I better do that. Let me ask you all. Just by a show of the poll, we're going to kind of just ask the question. How many people have actually heard of SHIP? And if so, have you ever used it before?
All right. Let's see, we got people answering. We'll give it a few more seconds. And then I will show the results. And again, folks, if you have any questions for James during this session, please type them in the chat box. And we will either get to them as they come up, or we will definitely get to them by the end of the presentation. So just a little reminder, feel free to ask questions in the chat box. All right, a few more seconds, folks, and then I'll close this polling. Okay, here we go, James. I will share the results.
Okay.
So we've had just a few have heard of it, and
Okay.
looks like one person who's heard of it has actually used it before. So that's really awesome.
Well, that's good. That's good to know. Well, good deal. Good deal. That's always very interesting to me, simply because, we SHIP is a federal program now. Okay, we get federal dollars to provide services, and what happens is a lot of people don't know that we actually exist. So, we always like to kind of get an idea of the group that we're talking with or speaking to as it relates to the program. So that was good to see. And now I'll explain a little bit about kind of what we do, how we operate, so that those of you who don't know, you'll have an understanding of what we do. And those of you who've heard of us before, maybe I can kind of engage you a little bit more on our services and the things that we do. So again, SHIP stands for the State Health Insurance Assistance Program. And in essence, it basically provides free help to people with Medicare. That's our deal. Okay. We provide public presentations, sort of kind of like what we're doing now. We also provide private counseling 101, right? So that's kind of our motto. Those are the things that we kind of help with. Again, we're funded by the Administration of Community Living and ACL, and we're administered through the Alabama Department of Senior Services. So basically, there's a SHIP office that's run through every county in the United States of America and funded under that Administration of Community Living. Now, some SHIPs are run through state departments of insurance, some are run through departments of senior services and the like, but nevertheless, we are all federally funded, and we cover every inch of the United States of America. We have a SHIP counselor that does what I do in every county. Okay. We are not sales agents. We're not brokers. We're not reps. We don't sell anything. Our mission is to provide free, unbiased help to Medicare beneficiaries and their families and caregivers. So that's kind of what makes us unique. We don't have any skin in the game, so to speak. We are basically tax funded. I mean, your tax dollars provides the support for us to even run this program. So this is something that you're getting back through your tax dollars that you've paid for. That's kind of one of our deals here. Our program has committed volunteers and community partners to assist beneficiaries throughout our region. And our region is in SARPC, Mobile County, Baldwin County, and Escambia County, excuse me. However, we do cover all 67 counties in the state of Alabama. So there's 12 other people that do what I do in the state of Alabama. Next slide, please. Okay, so again, what can we do? Basically, the whole point of SHIP is to help people understand their Medicare benefits at the local level. That's kind of the idea of the program. It's to keep people from dialing 1-800 numbers and necessarily having to get help from someone out of state, right? So our mission is to provide people with that help at a local level. And we do that through assistance with Medicare prescription drug plan benefits, Medicare Advantage plan benefits. We provide information on Medigap or Medicare supplemental policies. Also with coordination of benefits. That one is a pretty big one right now, because a lot of our people that are 65 and up or turning 65, many of them, unlike previous generations, are still working. So we deal with a lot of HR departments, human resources, with them and coordinating those benefits with their retiree packages. There's a lot of people that are retiring, kind of wondering, how does Medicare work with my employer group, that kind of thing. So we spent a great deal of time with that. We spent a lot of time with appeals as well. There's a lot of people that want to appeal decisions by Medicare. Your local SHIP can kind of help you with that, help you file that appeal and that kind of thing if you disagree with a claim or something of that nature. We also provide information on cost saving programs, and I'll talk a little bit later about that and the impact that has on our region as a whole. There's a lot of ways to save money on Medicare that a lot of people don't really know exists. So, in essence, again, we help people make informed choices about, their health insurance. That's kind of the mission and our goal with the SHIP program. All right, next slide, though. So, okay, now we have Medicare open enrollment season, and as Ms. Dorothy just mentioned a little bit ago, October 15th, tomorrow, begins Medicare open enrollment. So if you are 65 or you're on disability, if you have a loved one, family member, friend that are 65 or older or on disability, you have seen them be inundated, if not yourself, with information as it relates to Medicare this last month or so. Okay, they've received mail, you watch television, you see commercials with Joe Namath and JJ Walker from Good Times and all these people of the past. They're all over the place telling people what to do or giving people, encouraging people to call numbers for Medicare help, right? And usually those are going to send you to a broker, okay, or a sales rep. What we're here to do as your local SHIP is we're here to help you with those same services. And again, we have zero skin in the game, you know. So October 15th through December the 7th is Medicare open enrollment season. And basically what this is a time for people who already have Medicare, not people that don't have it, but the people that are already enrolled in Medicare. This is an opportunity for them to compare what they have now to what it will look like next year. So in other words, there's plenty of people that have Medicare prescription drug plans, they have Medicare Advantage plans, those things, and they want to compare or need to compare what that policy will look like going into the new year, because they oftentimes change. And even if those plans do not change, your situation may have changed, right? You may have another doctor, you may have another illness that you didn't have when you enrolled the first time. You may be seeing you may be in another network, right? Doctors and other networks. You may take different medications, right? So there's a time of year, which is now, to look at these things and compare these plans to make sure that you're getting the best plan for yourself. Okay, so that's kind of what we do here. And again, you know, unbiased, personalized counseling. We are doing it at this time from a safer remote counseling aspect. You know, we're limiting face-to-face services due to the pandemic. I mean, this is our second year now of doing it basically remotely over the phone or email or what have you, Zoom. But we can get the job done. Okay, we can get and it doesn't matter if you email, it doesn't matter if you have internet, we can help you regardless, whether it's over the phone or by postal mail. We can provide the services to you. We are now accepting counseling appointments. So, you know, I'll have my contact information back up here shortly, but we are doing that, and we're doing that kind of across the state. Now it varies depending on what part of the state you're in. It does vary. Some people are doing face-to-face, you know, so there are some SHIP programs that are actually having people come into the building. Here in Mobile, in our particular region, we're limiting that as much as possible. But in some other areas, there are opportunities to be seen. And these service delivery options have provided us opportunities actually to serve more people. Dorothy and I was kind of speaking about that earlier before we started on this call. So again, Medicare open enrollment, we are accepting appointments. We encourage everyone, no matter what you have, even if you love your plan endlessly, we encourage you to give us a call, you know, shoot us an email, let us review your plan. It may be a situation where you don't need to change anything, but some of you may find out that you may save a lot of money by changing. So we encourage you to do that through us. Again, we're not a sales agent. We're not brokers. We don't do any of those things. Our job is to educate you so that you can make an informed decision for yourself. And we can enroll you. I mean, we can enroll you ourselves, or we can refer you to an agent or a sales rep manager in our area that we trust, because there's so many of them out there. We don't know who all of them are. So you always want to start through your local SHIP. Next slide, Dorothy. I also coordinate another program called Senior RX. This is a free or low-cost prescription drug assistance program. This program is actually funded by the Alabama state legislature. So, this is not a federal program. This is actually a state-run program. And it basically is designed to help people who are struggling for money to pay for needed prescription drugs, right? So we do this, and it's typically for people who are age 55 and older, or people that are on disability who are diagnosed with a chronic medical condition requiring daily medication. Since its inception in 2002, the Senior RX program has saved thousands of Alabamians millions of dollars, and I do mean millions, in medication expenses by providing this free or low cost prescription drugs from pharmaceutical manufacturers. That's basically what it is a manufacturer pharmaceutical program that we get the drugs from directly to the consumer. Next slide, please. So how can it help? Okay, so basically, it was designed to help people manage their chronic illnesses earlier and prevent more serious health problems later in life. So we want to engage as many people as we can as it relates to this program, because it will help people obtain those needed prescription drugs at a cheaper rate, or a more sustainable rate for them financially. People who qualify for Senior RX receive a 3-month supply typically of prescriptions from various pharmaceutical companies, as long as they're eligible. And each company, it's not, the eligibility standards is dependent on the drug that you take in the company. So, whether it's Merck or Bristol Myers or whoever that makes that drug, they typically have their own subset of standards that they will require in order for someone to be eligible. And typically they're minimal. To qualify, though, generally, you must be at least 55 years old with a chronic medical condition, have no prescription drug insurance, and must meet certain guidelines. When it says no prescription drugs, sometimes you can have prescription drug insurance, but it may not. If your insurance doesn't cover your drug at that cheaper rate, we would consider you underinsured. And in that situation, you still would be able to get the help most of the time. Social Security disabled individuals are also eligible who have applied for disability, or they have a doctor's declaration of disability, who are in that 24-month Medicare waiting period, right? So if you're disabled, you are eligible for the program at any age, right? Doesn't matter if you're on disability at 20, you're still eligible for the Senior RX program, okay? And basically what it does is the program allows assistance, it provides assistance, for individuals to utilize their limited income for food and other important expenses, right? So, we don't want people breaking pills in half, borrowing from family members, those type of things that happen because they just don't have access to the drugs that they need, right? Our community partner is Ozanam Charitable Pharmacy. They provide a tremendous amount of support for this program. They do a great, excellent job with helping people on this program. Just to give you a little tidbit of information, there's a gentleman that I helped years ago with this particular program, where him and his wife had a decent retirement income, and he was diagnosed with ALS. And there's a particular drug called Ryutech that he was prescribed. Now, this drug roughly was running him, even with insurance, it was still $1,500 a month is what he was asked to pay. And because we were able to get him help through Senior RX, long story short, that program was able to get that drug directly through the manufacturer for him, mail order to his home, and he didn't pay a dime for it. And I think he's still getting it today. So that's the impact of Senior RX. All right, next slide, please. Senior Medicare Patrol, it's also a program that I coordinate here at the Area Agency on Aging, and it's housed within the Alabama Department of Senior Services. And basically what it is a preventative educational program whose goal is to reduce Medicare error, fraud, and or abuse through our statewide coordinated efforts. There's a SMP program that covers every county in the in Alabama. Actually, we also cover all of the United States as well, but typically here primarily here, in Alabama, we cover all 67 counties and 13 regional area agencies on aging. The idea here is to protect your card, to detect, look for any unusual charges, and to please finally report those. Because what happens is most of the time, this program, we get very few people report issues. We want to change that. We want people to be a little bit more active in helping detect errors, fraud, and abuse, because it ultimately will bring costs down when it comes to Medicare and the rates that we see in premiums, deductibles, and the like. Next slide, please, Dorothy. So, basically, our SMP program, as far as current trends, we work with community partners such as AARP and the like, to work and get them to help us educate people about, Medicare benefits, Medicare statements, understanding things like Medicare summary notices, understanding Medicare Part D prescription drug plan, explanation of benefits, Medicare Advantage plan, explanation of benefits. We're here to help people do that. There's a thing called the summary notice or explanation of benefits that come to you as a beneficiary. And what it says at the top, most of the time in big bold letters, it would say, this is not a bill, right? And because it says that, what most people do when they pull it out and open it up, when they notice that it's not a bill and they don't have to pay it, they trash it, right? Without really looking at it. And Medicare fraud is roughly a $60 billion industry, right? It's a lot of money in frauding the program. Medicare has roughly 63 million people enrolled in it. It's the largest insurance program in the country by far. And with that being said, there's a lot of opportunity to steal from it. There's a lot of institutional fraud. There's a lot of just flat out criminal, element fraud that happens. So some of the things to check for when you're looking at your summary notices is looking for things that services or supplies that were not provided, right? This is, there's some things you may get billed for that you didn't get, that you didn't receive, right? Duplicated payments, you always want to kind of look out for that. Did they bill you twice, right? Billing for equipment not delivered or no longer used. Well, that during the Obama administration back in 2010, there were some things that were put in place to kind of help with some of this, but still an issue today, though. For example, I don't know if you all could attest to this, but there was a time when everybody in the city, if you were a certain age or had any kind of disability, you were given a motorized scooter or something of that sort, right? And Medicare was paying a lot of money for these things. And what would happen is, some people would sprain their ankle, they would have some type of, illness or injury that would normally take a few months and they'd be back on their feet. And they were giving people motorized scooters for that. And Medicare was paying for those outright. And some of the problem with that was those scooters would be parked in parking lots and hallways and the grocery store. People were no longer using them and Medicare was paying for them. So now they rent those for people, right? They rent those instead of paying outright as a way to save money, scooters, walkers, wheelchairs, back braces, knee braces. All of these things are fine if they're actually needed, but sometimes they can be billed to you without consent. So you need to watch out for some of those things as beneficiaries. Ordering unnecessary lab services. This happens quite often as well. A lot of places it's just in their practice to do things of that nature, which we call abuse. It's not necessarily fraud. It's just an abuse of practice, right? Sometimes people bill for things. It's okay to ask questions, as it relates to COVID-19, there's a lot of scams, a lot of things kind of going on with that. Be sure that you are going to legitimate testing sites And also, if you're getting your vaccine, make sure you're going to legitimate places. Give our area agency on aging a call. We'd be glad to kind of steer you in the right direction. Don't let people call you over the phone, especially this time of year. It's Medicare Open Enrollment season. There's people, it's actually illegal for agents or reps to call you unsolicited. So you shouldn't be getting someone just calling your phone saying, hey, I want to talk to you about Medicare Open Enrollment. If you do, please call us. We have a relationship with the Federal Government Office of Inspector Generals, and we can get them reported. We don't need anything other than a phone number. You don't have to give your information to them at all. But if you can give us a phone number, that's enough for them to investigate it. Next slide, please, Dorothy. Okay, so I mentioned earlier about cost saving programs. And one of the things that, the local SHIP takes much pride in is our ability to educate people and save money for folks. That's one of our sticking points, not just for the actual consumer, but even for the region as a whole. From an economic standpoint, we're able to put money back into the local economy through this outreach and education. So basically what we do, when you see ADRC there, that stands for the Aging Disability Resource Center. So basically what that is in order to keep you from getting voicemails all the time, when you call our different departments, we actually have a team of people that do intake for us. So when you call our agency, you're going to get what's called an Aging Disability Resource Counselor. Okay. And what they're going to do is they're going to screen you for all things that are available for you through our agency. Okay. They're actually SHIP counselors as well. They can help with Medicare and the like. So ADRC just stands for Aging Disability Resource Center. And we have counselors that are here to do that so that we can keep from dropping calls, so to speak. We want people to call into one centralized line here. And this is typically across the state now. This is not specific to the Mobile Baldwin area. This is specific to the state when it comes to this. So 2 programs, one, Extra Help, also known as low income subsidy. This is a federal program through the Social Security Administration. Unlike Senior RX, this program is used to also help subsidize the cost, but it's actually run through the federal government. So before we even go to Senior RX with people, we check with this subsidy program first, right? This is the first step. We see if they're eligible for this. And you can see the monthly incomes there, $1,630 a month for a single person, $2,197 a month for a couple. So, anyone who has a total income monthly, this is retirement as well as Social Security, whatever your monthly income is, if you're in this range, and resources are counted. What are resources? Well, not the home you live in, but if you have other property outside of the home you live in, that would be counted. For a single person, if they have more than roughly 14,000 in the bank, that would be counted against them. Married couple, I think it's somewhere close to 30,000, 27,000, somewhere around there. So because it's a federal program, resources are counted. You can't have your home and own 2 rental properties. They're probably going to count that against you. But if you live in your home and just have your car, that type of thing, and you have less than those amounts in CDs, stocks, savings, then you're probably eligible for this program if your income is at that level. Now, what does it do? So, for example, that gentleman I mentioned to you earlier, let's say he happened to meet the income threshold. He did not. That's why I couldn't put him in this program, and I had to put him on Senior RX. But if he did meet the income threshold for this particular program, what would have happened is that $1,500 medicine would have turned into about $8.40 for him. That's the power of Extra Help, right? There's so many people that are eligible for it. They don't know that it's even out there. Okay. So brand name drugs, $8 and change, generic drugs, about $4 for generics. Okay. And most of those are even free. Now, you don't get anything tangible with this program. So you don't get an actual card. What happens is the federal government, once you're eligible, they tag or flag your insurance card. So when you go to the pharmacy and they swipe your card or they run your number, that card is flagged, and those reductions or that subsidy will tell that pharmacist that you're going to get that drug at a cheaper rate. Okay, so a lot of people are on it and they don't even know they're on it, believe it or not. One way to find out is most people, they know what they pay at the pharmacy. So if you ask someone, well, how much are your drugs? If they say, well, most of my brand name drugs are about $8 and my generic drugs are about $3 or $4, they're probably already on this subsidy, but they don't have anything to show you. They have a letter, that they'll get from Social Security saying that they're approved, but they don't get a card. Okay, very powerful program. Those numbers are good across the country. That's not a state number. Those numbers are the legitimate numbers for anybody in the United States. Okay. The other program is Medicare Savings. It's actually a Medicaid program. This is a state-run program, unlike Extra Help, where that's a federal program. This is a state-run Medicaid program that actually pays people's monthly premiums on Medicare. So, when you go into Medicare Part B costs people $148.50. That's the standard premium for most folks. There are some people who pay more than that because their incomes were higher when they were working. So most people pay $148.50 to be on Medicare Part B. Part A is typically premium free, simply because we've worked or your spouse has worked, and that's the taxes that they take out called FICA when you're working, Federal Insurance Contribution Act taxes. So most of us don't pay a Part A premium. If we had to, it would run us roughly just under $500 a month. But because we worked and paid into the system, we typically get Part A premium free. But again, Part B, we all have to pay for, okay? $148. However, if a person's income is in the limits below on the screen, the $1,469 for a single, for a married couple, $1,980, if that's their monthly income, the state will actually pay that $148 for them. So just to give you an idea of how that works, I had a person on the phone a week ago. The lady's been on Medicare for several years. Roughly, she was in her 80s. So she'd been on Medicare almost right around 15 years, somewhere around there. Okay, a little over. Long story short, this lady's income was roughly about $1,200 a month. She didn't know that either one of these programs exist. But we were able to enroll her in the Medicare Savings Program, and they were able to put that 148 back into her check. So now her check is closer to the $1,200-$1,300 mark, right? Just because of that savings. The problem we have, though, is look at all that time and all that money that she was giving away and didn't know she was eligible for. That's the concern, right? There's so many people that are eligible. $148, they're taking $148 out of some people who are only getting $700-$800 a month, and they're taking $148 out of that. So these are significant amounts of money for people on fixed incomes, to get put back into their check. So the problem is there's so many people eligible, but not enough people enrolled. And that's kind of what we're doing today, is just educating you guys a little bit on the fact that we're here to help with that. Next slide, please.
And James, thank you so much. Before we move on, we had a really good question. I think this might be
okay.
I could be wrong, but I'm gonna
sure.
Might be the right time.
Okay.
Margie asked in the chat, is it best to get A and B with Medicare? And how do you know if a plan covers both A and B?
Okay. Well, everyone on Medicare will have to have A and B typically. Okay. No matter what direction you go, typically A and B, most people will have to have. The only people, and just to explain what A and B is briefly, Part A is hospital coverage. Okay. That covers inpatient treatment, hospitalizations, and things of that nature, right? Part B is medical coverage, outpatient treatment, doctor's appointments, labs, x-rays, CT scans, MRIs, those things, right? So that's called original Medicare. Everyone starts out with those two. The only time you wouldn't necessarily need one of those, like Part B particularly, is if you're 65, you're still working, and you have employer group coverage. Well, because you have employer group coverage, Medicare never will pay primary over your job, over your employer group, if you're actively working. So that's the gist of it. But typically, you're going to have both, primarily once you retire from employment, right? Once you're no longer working, you're going to have both. And then from there, you can choose whether you want a supplement to go along with it or a Medicare Advantage plan. That's kind of what this open enrollment thing is because Medicare covers so many people, it has a lot of limitations. For example, Part B is an 80-20. So what happens is if you go to the doctor with a red, white, and blue Medicare card with A and B on it, that doctor charges you $100 for that visit. Medicare Part B will pay 80 of those dollars. Your copay would be 20. But the same is true if you go to Alabama Orthopedic Clinic and get your shoulder scoped, right? Outpatient procedure. Well, Medicare will be billed roughly, let's just say $10,000 for that. Medicare Part B is going to pay $8,000. You're going to get billed $2,000. You see where, so it's so subjective. So therefore, people supplement it with other things. And that's kind of what we help with doing Medicare Open Enrollment. So Part A and Part B by itself can be costly, is what I'm saying.
Right.
So there's ways to kind of fill those gaps in. Great question. Great question. Are there any other questions about that?
Oh, not at this point right now, but that was a great answer. So thank you for that, James. And I will continue on to the next slide. And remember, folks, please feel free to ask questions in the chat. Again, Miss Margie, thank you so much. That was a great question. And here's our next slide, James.
Okay, all right. So this one is one that I like to present to people for several reasons, actually, because this is kind of the silver lining in what we do. You know, this is the actual impact of the services that we provide as an agency, not only to you as a beneficiary, which is the most important, by the way, but also secondarily, you know, with our city officials, with our state legislative people, with our politicians and the like, who are over giving us the funding. They oftentimes like to see the economic impact as well, right? So what I like to do is show people what our services do, right, as far as the impact. So as you can see, this is specific to Mobile, Baldwin, and Escambia County. This is not even including the other 64 counties in the state. These numbers would be much higher than that. This is just what I'm doing here in my specific region. So it will give you an idea of what the state probably looks like if this is done. So for me specifically here, we counseled over 7,600 people in fiscal year 20 through SHIP. Out of those, we were able to enroll 477 people in extra help or low income subsidy. That's the program that helps pay for people's prescription drugs, right? Because of those 477 people, we saved over $2.3 million on prescription drug costs. Again, that's a person that was paying $60 at the pharmacy before they realized extra help exists. Now they're paying $8 at the pharmacy, right? Or $100, or now they're paying $8, you know, so that's the benefit. But one thing I want you to notice is we screened and talked to a lot of people and we helped them with various things, but we were only able to get 477 enrolled, which means that there's a lot more people in our region that are eligible but not enrolled. And just off of 477 people, that put alone $2.3 million back into their pocket. That's money they can spend with their grandkids, money they can buy food with, money that they can, put back into the economy, as well. So very significant impact for the small amount of people. 498 people, almost 500 people will help with Medicare savings. Again, that's the program that pays that $148 for folks. And you see, we put over 887,000 back into those people's pockets. So between the two programs, those two programs alone, just me and Mobile, Baldwin, and Escambia County, we roughly put, almost $3 million or so back into the local economy. And people's pockets, and trust me, these grants are not that much. So, we're giving them, putting money back, 10 times versus what they're giving us. But we really feel like we can do more. We really can help with more, and we need as much help as possible in doing that. As far as Senior RX, we dispensed over 13,000 medications in year 20. And that saved people that were uninsured or underinsured $5.6 million. So huge impact. Huge. I mean, some of these grants are less than $200,000 grants. I mean, these grants are the money that we're getting versus the money that we're putting back out is tenfold, but the impact, we can have a bigger impact, believe it or not. And that's something that I feel is very important. Even during open enrollment season, that's not even on here as a savings, but us sitting down with people doing open enrollment and actually comparing the plan that they have now versus what they can get next year, those are significant cost savings. Some people may, if they stay with the plan they're on, they may spend another $5,000 out of pocket versus going with another plan and spending, maybe $1,500 out of pocket. So those are things that are not even tallied on this sheet here that we help with every year. I think we have another question.
We do from Miss Margie again. And she asked, is there a plan that will cover the 20% that Medicare does not cover? And I think that's pretty much what open enrollment's about. Is that correct?
Sure, absolutely.
Yep.
Yeah, there's two ways that you can fix that. There's originally there's something called Medicare supplemental policies or Medigap. These guys have been around Medicare a long time. They do just what they say. They supplement Medicare. So you have Medicare, and then that 20% that's left off any gap, their job, it's an actual insurance that you can buy, and their job is to pick up the gap. That's what they do. They're around, they've been around for years. We definitely can get you information on those and some of the pitfalls and things to look for with that. And then the other alternative is what you're probably getting more of in the mail and what you're seeing on television are what's called Medicare Advantage plans. These are more like HMO, PPO, network-based plans that you can get in lieu of using your regular Medicare card. So what Medicare tells the private sector is, we'll approve you to provide insurance for our beneficiaries. So it kind of looks like employer group coverage. Like I have a Blue Cross PPO network-based plan on my job here, right? Well, there's an opportunity for people that have Medicare to get something similar to what I have on my job, but it's through a Medicare plan. They don't have to be attached to a job to get it. That's what the competition is, though, because Blue Cross, Humana, Cigna, United Healthcare, AARP, all of these companies that you see on television, they're all competing for your business, right? So what we do as a local SHIP is our job is to make sure that we educate you on some of the things that could be risks to you, that you can make an informed decision for yourself. Yeah.
Excellent. Excellent. Great. Another great question, Ms. Margie, and another great answer, James. What you do is so important, because it's like just looking at this impact, you're not just saving people money, which really is the key. And like you said, people are able to buy groceries because they're on these plans when they couldn't afford them before. And that's so important. But it also, it has this huge kind of trickle down effect where, it winds up helping our economy because people have more money to put into the economy, which helps, kind of helps lower costs in other ways. And so it's just, what you do is just so important to not just the individuals who need this, but to our economy, to our state as a whole. So it's really interesting to see how impactful it truly is. And like you said, this is just for like the lower Alabama area too. So it's amazing. It's just amazing. And I want more people to know about this and what you do, because it's so important.
Thank you so much for that. I we really believe that, I've been doing this roughly on it for roughly 20 years. And I've seen the differences in this, and how this impacts communities, how it helps people. And I've seen what people do when they don't know. A lot of people freeze. This time of year is very concerning for me, because I know what happens when people are overwhelmed with information, right? Especially in today's society, everything is on the internet. Everything is on your cell phone. And there's a misconception there that because it's readily accessible, that everyone understands it. And it's just not the case. I can pull it up on the internet all day, but unless someone explains to me what I'm looking at, it doesn't resonate,
Right.
And that's one of the beauties of SHIP, is that, we touch all spectrums, we touch all races, we touch all financial categories, we help everyone, because the reality is, from the doctors, the lawyers, the scientists, to people that didn't graduate high school, or people that, are in rural areas, non-English speaking, whatever the situation may be, no one knows more than the next. That's the one silver lining in Medicare, because it's not common knowledge. People don't walk around knowing what a Medicare Advantage supplement or a Medicare Advantage plan is, and it doesn't matter what walk of life that they're in. That's not common knowledge, right? So, we understand that, and we want to make sure that people take advantage of this service, because it's your money. You as a taxpayer have paid for this service. All of our services are free. We don't charge anything. You've already paid for it. We're here to help you, because you've paid for this free service. You do not have to call these brokers and these agents to get their side of the story, when we're here
because they're going to be biased. So
absolutely. Oh yeah, there's no doubt.
They're going to want you to buy their product. So
absolutely.
Right.
Yeah, they're going to want you to buy from them. And, we're in a capitalistic society. I mean, this is America. So what happens is, when people get on the phone and they sell you something, what happens is, legally, they protect themselves through things called annual notices of change. Well, legally, the insurance companies have to mail you a change notice, right? Legally, so that they can say, hey, we told you. But what they're going to do is they're going to send you a book about 3 inches thick, right? And expect you to go through that and understand it. Where what we're basically saying is, look, take advantage of our services. We do this every day. We do this 24/7, basically. Matter of fact, I see one of our program volunteers just came in. Miss Ella Jones is a volunteer with our program. We have a great volunteer network of folks that go in the community and kind of encourage and engage. So, I'm very appreciative to her for being on and for what she does for us. And we're really excited about being able to help people. And I hope that you all share our information and give us a call.
Absolutely.
I think my information is on the last slide too.
Let's see here. Let me switch. Yes, there it is. And again, I want to thank everybody. Please ask your questions in the chat. We would love to, James is here. I do want to point out too that, James, you talked about Senior RX and some of the Medicare help and stuff that is income-based, but just to call SHIP and just to see if you're qualified for these things, and to just get some assistance in comparing Medicare plans and things like that, that's free and that's not income based. Is that correct, James?
That is 100% correct.
Absolutely.
Yeah, 100%.
So, it does not cost you anything but a few minutes maybe on the phone, or a few minutes typing out an email to see what you qualify for, or to get some answers. Like James said, you may be happy with your Medicare plan at this moment, but your medical needs may have changed, where your current plan may not cover as much as, say, another plan might. And that's exactly what SHIP is there for, is to kind of help you figure out what is best for you, medically, health-wise, financially, to see what you need to do. And it's like, then it's completely non-biased. They're not making any money by telling you to, that they think this plan will work better for you than that plan. They're simply there to just kind of help you interpret it and make a good, informed, educated decision. And that's priceless. Absolutely priceless. So James, thank you so much. We've got James's information up here. I'm going to put his email address in the chat as well. Let me make sure I'm spelling it correctly. There we go. And the next slide is going to show you where, if you are not in the lower Alabama area, there are ways to find the information. You can call 1-800-Ageline anywhere in the state. And this will get you to your local area agency on aging and your local aging disability resource center that serves your county. So you are able to get in touch with them. That's 1-800-Ageline. And I will put that in the chat real quick. If y'all just bear with me, I'm going to put the numbers in there. 2, 5, 4, 6, 3. There we go. And then next, if you are online, you can go to alabamaageline.gov/AAA-locator, or if you just go to that alabamaageline.gov, or even just, put it in the search Alabama Ageline, you should be able to get there and navigate to where you can find your area agency on aging by map. It's really cool. You just kind of scroll over it and it will show you the information you need. And again, James, this is just such great information that you're giving us. And folks, like I told you before, we are recording this. So if you registered through the AARP registration platform and got the confirmation email and everything, give me a few days. Once this is uploaded to our YouTube page, I will send an email to all those who have registered, and it will have the link for this recording so that you were able to go back and look at it anytime. We also have an extra treat. Again, open enrollment starts tomorrow. We also do have an extra treat for you. Captain James will be back with us talking about SHIP next Wednesday at 10 a.m. That's going to be live on our Facebook page, AARP Alabama's Facebook page. You don't have to register for that. You just have to show up and listen. It will also be recorded. So if you don't catch it at 10, you can go back on our Facebook page and look at it anytime. But that will be another live presentation similar to this. But if you do happen to have any questions after a week of looking at open enrollment stuff, come back, watch us, ask questions in the comments. That's what we're doing this for. So James, do you have any closing comments?
Yeah, just briefly, again, just encourage each of you to, contact our agency and just give us an opportunity to help. We do many things here at the Area Agency on Aging. So, specifically, I deal with what I just showed you, but, we encourage you to give us a call. We want to help you. We want to develop partnerships with the community. We want to be a part of the community. We are very grassroots oriented. This is how we do business. You won't see a SHIP commercial on television, unfortunately. You won't see a lot of that, but we're here because of partnerships with Miss Dorothy and all the other organizations in the community. That's what we depend on, and we really appreciate your time and support. Look forward to helping you. Don't hesitate to give us a call. Reach out to me via email. I'll be glad to help you. Thank you all so much for the opportunity.
And thank you again, James, for all you do and what all of your colleagues around the state do. This is just such an important program. And like you said, there's y'all can't do a whole lot of the marketing. So for this program, but we're here to help and here to spread the news and give you a platform. So I hope we were able to do that today. I hope we're able to do that next week as well. And folks, thank you so much for joining us. Let's see. Miss Ella, I hear something about SHIP every day, which is great. The word is getting around. Wonderful. And Miss Ella, thanks to you too. That we know you're a big part of that. So we really appreciate it. But folks, again, Thanks so much for joining us. You know, at one of AARP's big fights right now is to lower prescription costs for everyone, but especially for Medicare folks, people in Medicare. So we really appreciate it. Miss Margie says, great presentation. Thank you. Well, Miss
Thank
Margie,
you.
thank you for your great questions. Those were wonderful.
Thank you.
James, again, thank you for this great presentation, your great answers to those questions. I look forward to seeing you again next Wednesday. And this concludes our presentation, folks. Thank you so much for joining us, and I will end the meeting at this time.
Thank you all. Have a great day.